And now we are jumping right into our next topic, a personal favorite of mine, co-creation. Patient engagement and patient involvement are great ways to make a new health innovation meet the real needs of patients. But imagine going one step beyond and having patients as the idea makers, developers, implementers of technologies. How we could put this into practice is our speaker's role to tell you now. Our moderator for this session will be familiar to many of you. The discussion will be moderated by Nicola Bedlington, Special Advisor at EPF. Nicola, the floor is yours.
Thank you so much, Yvette, for that kind introduction, and I'm delighted and honoured to be moderating this really exciting session, which of course you can see on Swapcard. Over the last 3 days, we've heard loudly and clearly the crucial role of patients in digital transformation and the benefit of involving them meaningfully. This session will explore, as Yvette said, the role of patients as innovators, as co-innovators, with a glimpse at best practice examples, where challenges exist, but also where opportunities are to overcome those challenges and move forward. We'll look at the role of policy in facilitating and incentivizing co-creation and co-design, and we'll discuss the COVID-19 effect on the acceleration of digital health and what can be learned from this when it comes to patient innovation. The session was crafted by EIT Health and EPF together and drew very much on the broad messages from EPF's first Congress on meaningful patient involvement in health systems design, health services design. And today, of course, we'll delve a little deeper on co-creation. And of course, for this discussion, we have a great backdrop to advance policy and practice in this co-creation patient innovation space. The European Health Union, the European Health Data Space, the EU for Health Programme, and a brand new successor initiative to IMI, the Innovative Health Initiative, which embraces not only medicines, but also technology, digital and social innovation. So we're going to kick off the session with a poll, which you'll be able to look at on your swap card. So the real question here, which I'd like you to answer with one option, what in your view is the main challenge to co-creation in the field of digital health? Digital health literacy on all sides, lack of recognition of the capacity of patients to be active co-creation partners, lack of the necessary investment in co-creation opportunities, or no enabling environment which really fosters co-creation and digital health innovation. So I'd be delighted if you could answer that poll question, and we'll look at that a little later on in the session after the panel discussion as we go into the Q&A with you as the audience. And please, can I encourage you to put into your swap card chat function any questions, comments, reflections you might have, and we'll bring those all together in the Q&A. And we'll cluster those questions to get, to make sure that we can cover as many of them as we possibly can. So before we actually go into the panel discussion, let's look at the pitches, as we've called them, two excellent examples of patients as true innovators. And it's my pleasure to introduce Jaume Puig, who is the father of Biel and the co-founder and CEO of Biel Glasses. And also Dr. Esther Murphy, who is a research fellow in the School of Nursing and Midwifery, Trinity College, Dublin, and lead for the DigiID, an accessible digital skills education programme for people with intellectual disabilities in Ireland. And Mellin Lapp, her colleague, who's a member of the project's Citizens Advisory Panel, and we'll hear also from Mellin as well. But first of all, let's go to Jaume. Please, the floor is yours, Jaume.
Good afternoon. Thank you very much to EIT Health and the organization of European Patient Forum to give us the opportunity and the privilege to be here today, somehow representing the patients who innovate. And I would like to start my presentation talking about our project. Our project started with my son Biel. Biel was born with a disease that causes him low vision. When he was about 2 years old, we realized that something was wrong with Biel because it it took a lot of time for him to start working. And even when he started, he had a lot of accidents and injuries, and we didn't know what happened. And after visiting many doctors, we realized that the problem of Biel was in his sight because he had low vision. Low vision is when you are not completely blind, but you have a visual impairment that does not let you do the basic things of your life, and cannot be fixed with glasses or surgery. It's 7 times more common than complete blindness, and the worst consequence are the mobility issues that cause false injuries and dependency and social isolation. But people with low vision still see. They still keep some visual capacity. This is why our solution consists in smart glasses that adapt the reality to the remaining visual capacity of people with low vision, showing them obstacles and other risks in the way that they can see in order to improve their mobility and personal autonomy. But we don't want to spend more time talking about our product or our project. We want to talk about the way that we came to here. We decided to start the project because the doctor told us that there was no medical solution, and the only solution that we found to improve Biel mobility were just canes and dogs. And we were afraid that when Biel will grow as an adult, he would not have us to help him to go with him to everywhere, and then he would need this cane and dogs to be autonomous. And as I had an IT background, I guessed that the technologies like augmented reality and virtual reality that they was using for education and that are already being used in other fields, like you can see here, could help to solve this problem. This way we could have a different look to the problem and to find out that these technologies could bring a radical improvement to the lives of people with low vision. But I was not alone at all. I brought my knowledge as an electronics engineer, as manager, and as entrepreneur, but also Biel had around him a team of people perfectly qualified to carry out the project. As was like a miracle, because my wife is a medical doctor and is mother of Biel, of course, and she has extensive experience in clinical research. My brother is a computer engineer, an uncle of Biel with more than 20 years of experience in developing solutions for health. And Larry Sanchez, who was a friend of the family, is one of the best specialists in low vision in Spain. And actually, she was the first person to realize of the cause of the mobility problems of Biel was low vision. And this initial team allowed us to grow the company to the point that we could get other people, other specialists to create a winning team. And we also want to talk about other patients which helped us, not only to participate in the clinical trials that we're carrying out, but to help during the design and the development of the solution. We collaborated with patient associations from the very beginning that helped us to validate the need through patient surveys and also facilitated us access to patients that were testing our device during the development in order to continuously improve the prototype. And that's about our project and our role in it. And now we will talk about more generally about the patient innovation and about companies like us. This graph shows what is called the Valley of Death, which is the time among when you have a research project that has been publicly funded and the moment when you are able to get investment to fund it. But this is that works for the most of startups, and this is a big problem. For us, it's even worse because this is how actually this graph is for a patient-driven startup. There is no initial funding, there is no public funding for the initial research. As I like to say when I'm asked about it, this project started at the home of somebody who has a problem and no solution for it. So the companies that are driven by patients, we can fill the gap among the patients' need and the health systems offering. But we are not spin-offs, and we don't have any modern institution. We don't have initial funding for a previous scientific research. And our value is not in our personal knowledge of the problem, not in the doctorates that we have in the team, even when we have it. And we are sick, or we take care of people, sick people depending people. So we cannot be working 10 hours a day or on the weekends. So it cannot be expected that we spend hundreds of hours to make a proposal to get a grant. And so we don't have the time or resources to go through the innovation pathways of hospital, universities, or their spin-offs. And then we think that it is not fair that we have to compete with this kind of startups or organizations in order to get the public funding and the aid that we need to succeed. So my last statement is that we don't want to be heroes. We want to be normal people, and we hope that this session may help for this. Thank you very much.
Good afternoon. My name is Esther Murphy. I'm the activity lead for our EIT Health funded Pan-European Interdisciplinary Digital Skills Education Project, co-created with and for people with intellectual disabilities, their families and health professionals. Today, I am delighted and very grateful to have this opportunity to share our innovative DigiID co-creation story with you all. At this time of global pandemic, with just this week reports of 4.3 million deaths related to COVID, our research demonstrates a disproportionate impact for people with intellectual disabilities, with death rates for people with intellectual disabilities 6.3 times greater than the general population, and a 10-fold increased risk for people with Down syndrome. Also, the age at which COVID impacts is lower for people with intellectual disabilities. So for the 8 million people with intellectual disabilities who face these disproportionate health, well-being and inclusion difficulties, this time has been compounded. When we are also reliant on technology and on an ever rapid shift to e-health, with our research showing just 22% of a sample of up to 700 using technology, people with an intellectual disability are being left behind in our digital revolution, which is having detrimental impact for health, well-being and inclusion. So how can we tackle this grave challenge? We are adopting, in line with World Health Organization Sustainability Developmental Goals, a citizen co-creation program design and method, which fully includes our citizens, our learners with intellectual disability in all phases of our innovation. Following a rigorous ethics process across Ireland, the Netherlands, France and Sweden, we are running online multiple focus groups with our learners, people with intellectual disabilities and their supporters, to find out about these access barriers and facilitators to technology they're experiencing at this time. So far, we have learned that, like all of us, people at this time have felt lonely and at times scared, which has been compounded for our population due to the lack of access and digital supports, lack of devices and poor Wi-Fi, all impeding difficulties. We have heard that unlike mainstream population, use of technology to support health appointments, for example, has been extremely low, impacting their well-being. And we've also learned how dependent people can be on support from family and staff to stay connected, and the strain this can cause for all involved. We have also gathered these insights, and they are leading and feeding into the development of our solutions design and the tech development work. At the same time, we've been hearing amazing stories of patience, perseverance, and resilience. It is these positive stories that we are harnessing in terms of our DigiID solution. And indeed, at the heart of our DigiID project has been the establishment of our Citizen Advisory Panel. Our Citizen Advisory Panel is made up of 7 individuals with an intellectual disability who have a passion for technology and really are the beating heart of our project, sharing their lessons learned in tech with others. And we meet once a month, and they inform and shape the decisions and key milestone areas, from reviewing our focus group findings, from giving input into our design. And I'm really thrilled to be introducing you to one of our members, Maylin Yap, later, where we'll have an opportunity to look at the design together. They're really an invaluable part of our team. Core to our program is ensuring we co-create the most authentic, accessible, programme, adopting EU Easy Read principles, listening to people and learning that video is the format that is most preferred. We have been absolutely blown away by our talented panel, inspiring us and each other, and the power of peer support will be a core feature in our solution. We are also now scaling up next year, looking for new EU partners, and we have the excitement of being joined by industry leader Microsoft, continuing our work with tech accessibility experts Way2Be, and increasing our links with health and education sector. We are developing the potential of our citizen advisors and supporting them to be our future educators. We are so excited about this, that they will be the ones themselves addressing this digital divide. And as one of our panelists astutely noted, for most people, technology makes life easier. For us, it makes life possible. And I want to make life easier for people like me. We want everyone to enjoy the benefits of a full digital life in a safe way to enable a long and happy, healthy aging. We invite you to join us on our mission to ensure citizens with intellectual disability have the opportunities to imagine a fully digitally included life full of possibilities. Thank you. Good afternoon. I am happy to introduce you to Mei-Lynn, my teammate, a member of the EIT Health funded DigiID Citizen Advisory Panel. Today, Mei-Lynn is going to join us to discuss her experience working as part of our team. Thank you so much, Mei-Lynn, for representing our group today.
Hello, everyone. My name is Mei-Lynn Yap. I am passionate about using technology to stay connected, healthy and well. I am delighted to work as a citizen advisory panelist as part of the EIT Health funded by DigiID team.
Can you tell me a little bit about the Citizen Advisory Panel and your role, Mei-Lynn?
Well, there are 7 of us with intellectual disabilities in the DigiID Citizen Advisory Panel. Each month we have a consultation meeting. We review and discuss key project activities together, from designing the project logo, reviewing the project accessible resources, and the co-creation focus group findings.
That's great. Thanks so much, Mei-Lynn. I wonder, could you tell everyone about the work you are doing at the moment?
Right now, we are in the middle of a prototype review work. It's great fun. We check the tech and design work. We give suggestions to make sure DigiID has user-friendly features, is easy to read, and considers all reasonable adjustment for people with intellectual disabilities. We are also co-creating accessible videos with DigiID researchers to promote our project.
Feedback from our Citizen Advisory Panel and yourself, Mei-Lynn, plays a vital role in informing our decision-making. Now we thought it would be interesting to show everyone what we've been working on together. How about we take a little look? What do you think, Mei-Lynn?
Sounds great. I'm so excited to show you the design for the DigiID prototype. Firstly, I will show you the example that the researchers designed and showed us based on our co-creation focus groups. Then it will how it changed after our feedback. This is the old homepage. We can note that we had a time-based learning goal, and we thought it was not the best solution. For this reason, we suggested to change it to a goal to reflect skills learned. This change makes it easier for us to understand the meaning. We also see in this old design the words profile and in progress. We could not straight away recognize these words. So we suggested to replace them with my page and with courses you are taking. as you can see in this current version of the prototype. Another change we suggested was to modify Keep Watching block, highlighted here. Instead of just the name and the level, we suggested to add a picture that reminded the learner about which video they were watching.
Thank you so much, Maylin. It's been so helpful hearing those examples. We've also been hearing in our co-creation focus groups how important safety and security is for our community online. Thanks to this engagement and listening to feedback from yourselves on the panel, we have learned so much. Maylin, I wonder, could you share maybe a final 2 examples?
Sure. We suggested to add reminders if any of the learners' information was set to public view, because in our opinion, it is very important to ensure that the learner is aware of this. Finally, we also suggested to add the possibility to give a quick and easy feedback on courses, like thumbs up or thumbs down. This change can be useful to give information to improve the course or the application if needed. Me and the other citizen advisory panelists are working also on the co-creation of the DigiID education tutorials. For example, I'm now co-creating the scripts for how to start with Facebook. And you will find my video lessons and easy read documents in the prototype courses section.
Thank you so much, Maylin, for sharing the rich input you and the panel are giving us. We are so proud you are part of our team, and I'm really excited to be working with you on creating your video tutorials. Your work with the panel is the heart of DigiID. It is so valuable for making sure we co-create the most authentic digital skills solution for people with intellectual disability. It is a pleasure and a privilege to innovate together, and sincere thanks for joining me here today at the Congress.
Listening to our voices, the voices with intellectual disabilities, to make changes to ensure we are digitally included is impactful and powerful. Thank you for the opportunity to be part of DigiID and to represent the group at the Congress today.
You're more than welcome, and thank you everybody for inviting us to be part of the Congress.
Like to learn more about our project? Follow us and visit our webpage. Thank you for watching.
So thank you very much to the 3 of you for setting the scene so beautifully. And clearly it resonated very well with our participants. We've had some fantastic feedback already. So now let's go to the panel. I'd like to kick off with you, Jan-Philipp Beck. Jan-Philipp, CEO of EIT Health, and many thanks for your involvement in the Congress and also your role on the advisory board. Just thinking about the presentations that you've listened to and watched, we know through the collaboration between EIT Health and EPF that you have a real commitment to patient engagement. Could you share with us a little more the EIT strategy and approach here?
Nicola, thank you so much, and thanks for having me on this panel. Of course, can do that. First of all, really congrats to Esther, to Jaume, and also to Maylin, who was joining that session of a video. I think this is really truly impressive what you've been working on and achieving. So I'm really deeply impressed by that. So to EIT Health, we are a knowledge and innovation community. Connecting people across Europe, and it's our commitment to First of all, that patient engagement, of course, starts with the fundamental understanding, right? That health is about people and that we were created at EIT Health to benefit society by means of innovation. And so innovation is, for us, of course, a means to an end. Now, these kind of very simple but important facts, I think, represent the guiding principle for EIT Health, inspiring us to really ensure that patients are not only front and center, but also really meaningfully implicated in what we do. So very concretely, two things, Nicola. So first, we promote really the involvement of citizens and patients as early as possible and throughout the whole healthcare innovation pathway. So for us, innovation really, or involvement in innovation happens when people share their views and experiences, and when these are really taken up to guide and inform how activities are designed and carried out. So co-design, co-creation, this is important. So activities are really done with people, by people in this framework, which is different from maybe just participation of patients in maybe clinical trials where activity is, well, maybe more about people than really with them. And I think there are particular opportunities also in digital health, also in medtech, in the examples that we've seen, to really bring that vision to life. And within the community, so we provide a framework from which co-creation can really take place. Of course, we respect also legal or ethical concerns by utilizing also our network to provide really good means for collaboration. We do this in different ways, including also education with and also for patients and citizens. We have entrepreneurship programs to support innovators with co-creation or with patients in creating their own innovative solutions, and providing also test beds and living labs to foster that interaction. So we just heard from Jaume, who is a patient and innovator, and from Esther, whose educational program is really developed and deployed together with patients, with citizens, as we saw. And I think two of you exemplify tangibly and admirably patients' significant potential to be involved in innovation. And I think your work was also supported by EIT Health, by our patient innovation bootcamp, as we call it, and also our citizen and patient engagement activity line. Now, I believe we also practice what we preach, and patients are active as contributors in EIT Health operations. That's not always easy, but I think that's what's really important. So to have them also as members of evaluation panels, as also expert speakers at webinars, at events, but also as members of our advisory board, so on ethical, social, and legal issues, but also we have a board on what we call high value care, and patients are represented. So we also support public outreach, of course. Round about 13,000 citizens and patients really were involved in our activities. We are still there learning, of course, every day how to do this better and better, and have the ambition to grow this.
Super. Thank you very much for that overview. And what is particularly interesting, and is definitely a mantra of EPF, is early and meaningful involvement of patients really early in the life cycle of any innovation, very much with patients rather than simply for patients. Terrific. Great start. So I'd now like to move to Signe Ratso, who is the Deputy Director General in DG Research and Innovation. And Signe has particular responsibility for open innovation and citizens. Signe, a warm welcome to you. And I'd like to hear from you, having again the presentations in mind. How does the European Commission see patient involvement in R&D in digital health? And would you have maybe a couple of really concrete examples to make that come alive for us? Signe, the floor is yours.
Well, many thanks, Nicola, for this kind introduction. It was great to see the pitches about the projects, and I'm particularly glad to join this session. As Nicola said, one of my responsibilities as a member of the board in DG Research and Innovation is really a citizen engagement. Now, coming to your question, first of all, what I'd like to emphasize is that the Commission already has a strong track record in supporting patient involvement. And an example of this is the European Joint Programme Co-Fund on Rare Diseases, which is a large consortium with 140 partners. that works closely together with patients, including children, to enhance their full empowerment in research. Now, let me also give a few concrete examples of some projects. The recently launched Screen for Care project, funded through the Innovative Medicines Initiative, involves patients to ensure that their needs guide the progression of the project, which aims at accelerating rare disease diagnosis by using newborn genetic screening and digital technologies. Amongst IMI projects, EU PATI and its successor trained both patient advocacy organizations and industry on involving patients in various aspects of research. And another IMI project, Paradigm, also put the principle of patients' engagement into practice and leaves a legacy that can be enhanced via digital means. Now, you've mentioned pandemic, and certainly pandemic changes it brought in terms of telemedicine. This is the trend for better patient involvement with the digital focus, and this certainly has increased and will be further supported. But let me also mention the cancer mission, because you may know that the missions are really the tool where we've involved citizens from the very start, starting from designing and also of the missions and setting the principles of the missions. And now, at the end of September, we've launched now the communication together with the implementation plans of missions, and among those also mission on cancer. And I'd advise you also to read the document so that you can really have a better understanding. But the mission on cancer sets the very ambitious overall goal of improving the lives of more than 3 million people by 2030 through prevention, cure, and for those affected by cancer, including their families, to live longer and better lives. And this goal is pursued together with the Europe's Beating Cancer Plan. So the mission has a unique cross-disciplinary approach. It will ensure a systematic integration of research as well as policy developments. It will generate new knowledge on cancer prevention and care, but it also will help speed up the translation of research innovation results into better care for patients. And as said, it also has regular citizen engagement activities throughout the life cycle of the mission as such. And certainly digital solutions will be one of those very important also for the mission.
Great, fantastic. That's a really clear overview. Lots of fantastic examples, and we'll make sure that all of these are captured in the report so that people can look at that afterwards. But this correlation with the cancer mission and Europe's Beating Cancer Plan, I think blending policy and indeed research in an integrative way is fantastic. And I know in both programs, the governance will involve patients and citizens, which is also absolutely critical as well. So thank you so much for that, Signe. Very, very positive from the European Commission. Let's move back to Jaume once again. So what, in your view, can be done to facilitate and promote patient innovation from where you're sitting, really working day in, day out on some of these things? What do you feel are the preconditions, and what might need to change to accelerate it even more for others who are interested in actually being part of patient innovation? Jaume, the floor is yours.
Thank you, Nicola. Well, stated in my presentation, I think the problem is that the most of the times we are getting into an ecosystem that is not designed for patients. For example, I always, when I wake up in the morning, one of my dilemmas is about if I should spend more time taking care of Biel, who is my son, and who the initial motto of all the project and the reason, or to take care of the company. I mean, how? Because I have to do both things, me and my wife. So it is something that it's a dilemma that I get, because we are not alone. There are other innovators like us, and we have been participating in EIT Health Ecosystem programs like Patient Innovation Bootcamp, and we found the same situations. We found people doing a very difficult effort because their conditions or the conditions of the people that they care of, trying to get into these programs, and it's very difficult. And then it is necessary, we want to really to leverage this potential of the patients to innovate and to improve the health system, to create the conditions for doing so.
Sure. No, I think you've raised a really, really critical point, and a point that we hear a lot in the European Patient Forum community. And it's interesting, and Esther alluded to it, this whole idea of reasonable accommodation to enable patients to really bring their expertise and knowledge, and people like yourself to bring their expertise and knowledge, while acknowledging some of the other challenges that are happening that also need really major focus, major attention. So this whole notion in the disability world is very common, reasonable accommodation. It's entrenched in law. I wonder if that's an area to explore ultimately as well. Thanks a lot for that very open comment, Jaume. Back to Esther, and reflecting again on your presentation together with Mylin, we hear a lot about the importance of patient empowerment on an individual level, but it seems that your endeavours with co-creation go rather further, in fact. Could you comment on that and how you see the difference?
Thanks so much, and thank you very much for Jaume's presentation as well. Really enjoyed it. So we've really been described as a project within a project through the establishment of the Citizen Advisory Panel, to incentivize that, to pay participants in the panel for working and acknowledge the contribution as key members of our team. In terms of moving towards enabling and empowering individuals to become our educators, it's really actually been accelerated in the pandemic, in the learning around how to use digital skills. And then the kind of the push for people to want to demonstrate those skills, and then seeing somebody like themselves show another person how to use, for example, WhatsApp was something, the voice note on WhatsApp was something we were talking about just yesterday, to show somebody else how to do it, and that we would enable that as acknowledgement of a skill that's being taught. And therefore, we would provide a platform on our solution through the video construction to show someone's skills and have that acknowledged. I think, from a policy perspective and linking that research, we do know that people with intellectual disabilities and people with disabilities have fewer employment opportunities. So when I say a project within a project, it's an area that we advocate for. The disability mantra of nothing about us without us is very critical. And I think it's kind of intending to move towards a space where people are valued in a monetary way, and that we move beyond voluntary participation in co-creation. This is a micro effort to do that within the project.
Yeah, no, I think that's a really important dimension. It's taking actually much more space now, with strong discussions on fair market value for patients' unique expertise, knowledge, experience. So I think it's a highly, highly relevant dimension to the discussion. Jan-Philipp, back to you. Building on the conversation so far, it's clear that the discussion is moving away from the risk of involving patients to actually the risk of not involving patients in terms of a business imperative, but also from the human dimension. What's your perception on this?
Yeah, thanks, Nicola. So I think, when it comes to innovations and innovators, I think we are faced more with a sort of limited knowledge about maybe what patient involvement can really deliver, and limited know-how and interacting meaningfully with patients, rather than an active, I would say, resistance because of the risk that it actually may entail. Maybe that's also a bit of a historical bias. So I think for a long time, health is focused on treatment and elimination of disease, and has seen health conditions as the feature of the person requiring the individual treatment by professionals. And I think this established both a hierarchy and a gap between science and scientists on one side and maybe patients and lived experience on the other. So I think we maybe have still these kind of siloed approaches to health that are for us to reverse engineer, having in mind the great benefits that patient involvement can actually yield. So to name the most obvious, really boosting success potential and reducing waste thanks to an in-depth understanding of patients' unmet needs and the outcomes that really truly matter to them. So I do believe that, seeing also patients as those with the insights, but also users, customers, I think we know also in the end from other industries that the co-creation, the co-design with customers is really important to be ultimately successful. Now, I've been monitoring a little bit the chat, Nicola, that was going on. It's an interesting conversation on the issue whether for some, and Jaume, you also mentioned that, is there actually sufficient time for patients to go that full journey, right? Also to commercialize, to scale. And I think that really ought to be discussed maybe on how one could potentially crack that nut. One of the commentators also said, well, we didn't engage in a boot camp or so because we felt it was simply too much. We want to focus on the development, but not necessarily on the marketing, on the scaling and all of that. And I guess, well, to be discussed. I think certainly it's important not to leave then maybe patients alone, but to build, I would guess, to build capable teams of around that. And because if you want to ultimately then have success in scaling and also have commercial success, of course, it can't be done by patients alone. So it needs opening up, it needs building teams around it, needs people coming in with different expertise in fundraising, management, and all of those things to ultimately make it successful. But in summary, I think, not involving patients, I do believe, is a great risk, particularly also in digital health.
Yeah, a really clear message and the importance of partnership, not leaving patients on their own to struggle with their idea, their concept, their innovation, but actually creating an infrastructure around them that will support them to deliver what they can more than happily do. Great. I'd like to move back to Jaume, actually. In a nutshell, why is patient innovation actually useful and beneficial to the wider society? It's clear it's beneficial to the patient community, a particular disease area, but why is it important for society as a whole, in your view?
Well, I think that what we can do is to try to perceive the gap, and then to try to fill the gap. The first thing that we can do is to detect, because we suffer the lack of solutions that may be for some conditions, especially in the part of the quality of life. Because as Jan-Philipp stated, let's say in the past, the health systems focused a lot in the diagnosis and in the treatment of the diseases, not in how to handle the conditions. So especially in the part of assistive technologies, I think that the patients can say a lot. But in general, we can say that we have the pain. We suffer the pain when there is no solutions or no good solutions or for the problems that we are suffering. So we are able to raise the hand and say, okay, there is a problem here. And afterwards, we can, if we are able to do it, if we are allowed to do it, if we have the conditions to do it, we can even lead these initiatives in order to create the solutions better than nobody, because we are able to validate the need. We can, when we are talking about marketing in health, one of the most important things that you need to know is if what you are trying to do, the solution that we are trying to do is something that is needed. And we really know that it's needed. And then we can put the focus in things that maybe it is not an interest on the industry, because sometimes the industry have their own constraints the industry or even the health systems, and they maybe that they are not interested in some kinds of solutions or solving some problems. And then we can do this. We can raise the hand and say, okay, there is a problem here. This is something that will benefit the whole society, because we all can be patients.
Yeah, thank you, Jaume. I'd like to actually highlight to participants that the pool will now be closing, and we'll be looking at the results in a couple of minutes. But in the meantime, I would like to actually come back to Signe, thinking about what we've heard so far in the session. How can we take things forward? What are some new opportunities on the horizon? For example, perhaps in the context of the Innovative Health Initiative, any thoughts around that, Signe, in terms of what's coming up that would perhaps help to solve some of the challenges that we've heard so far?
Yes, many thanks, Nicola, for this question. Before coming to this new initiative, Innovative Health Initiative, now listening to the comments by the panelists and also reading your comments in the chat, it seems to me that what we need, it's not only technological innovations, but also what we call social innovations because they bring together the patient groups who share the same issue, the same problem. And very often it's not just a gadget, a tool to solve your problems, but also then, for instance, how to use that, how to bring together your community, the people with the same issues. And certainly social innovation is also part of the new program, Horizon Europe. And I think also in the health cluster already in the first Beck program, there are already some of the topics like that. Now, as I already said, that during the pandemic, clearly also these tools, which enable monitoring your health online without going to your GP or your doctors. Now I see also this the online tool for blood cancer patients in the chat box. I can also mention, for instance, I Manage a Cancer project, which empowered people with cancer and their families to actively manage their disease through health apps and secure e-health services. Now coming to this, the Innovative Health Initiative, really it will bring together diverse stakeholders, universities, companies, other health stakeholders in collaborative projects where there is a high burden on patients and or society. And these certainly have the key role also enhancing patient involvement. Let me also mention another partnership on personalized medicine, which is a patient-centered approach in the provision of healthcare, including via digital solutions. And similarly, the foreseen partnership on rare diseases would further develop an efficient ecosystem, keeping rare disease patients at the center. Now, concerning innovators, European Innovation Council is also expected to support both patient empowerment and digitalization. It recently awarded a grant to Acaron Robotics, a robotics and AI company which focused on delivering innovative robotic solutions in the healthcare space. And this will support the company in pioneering new, safer and faster ways of decontaminating hospitals. I already mentioned the cancer mission. Now, in addition, the declaration of principles of successful patient involvement on cancer research has been published by the presidency trio, Slovenia, Germany, and Portugal, which also stressing the involving patients. And finally, I'd like you to also provide your input for the discussion on the future of Europe. For example, via the online platform, allowing to share ideas on the topics like health and also digital transformation, because this is really the way that you can be involved in designing the future policies together with the policymakers.
Fantastic. Very good, Signe. That's given a whole range of opportunities and a call to action to really get involved, to be engaged in the future of Europe, to help to define what is missing from a crucial patient perspective. Thank you so much. So the results of the poll have come in, and it's pretty clear, as you will probably be able to see as well. The number one challenge is a lack of recognition of the capacity of patients themselves to be active co-creation partners, with 45% of the vote. So that is a really, really clear message. And I think it's been echoed very much in the discussion we've had so far. So we need to do some more work on that. The absence of an enabling environment which fosters co-creation and digital health innovation also came up high. And I think that's also been echoed particularly by Jaume. And I think we've got some good ideas flowing about how to actually address that as well. Digital health literacy is also a challenge, with 18% of the votes, not just the digital health literacy of patients, but the digital health literacy of all of the other stakeholders in this whole crucial topic of change management and shifting culture. And then investment, the lack of necessary investment in co-creation opportunities. As we've heard, patient leaders with expertise, knowledge, experience need to be compensated for that, and to be part of actually moving forward, bringing that knowledge together, being fairly treated, if you like. And that means reasonable accommodation, but it also means the right sort of compensation commensurate with what they actually deserve. So that's been a really, really interesting poll. We'd like now to open up to the Q&A, and we've got a couple of quite interesting questions so far for all of you. First of all, we've had a question: is any of the panelists aware of an industry-initiated overview that gives space to patient co-creation? For instance, where medtech solutions exist for a disease-specific challenge they're faced with, or where companies might be particularly interested in co-developing a solution. So a sort of repository, if you like, where people can go, patients can go to find out a bit more information about their particular disease area and co-creation opportunities. Any thoughts perhaps from Jan-Philipp?
Thank you, Nicola. So the question is, sorry, just to get it, whether industry has created such a repository to...
Indeed, industry, or indeed perhaps parts of the EIT Health Ecosystem. Are you aware of one single place, a one-stop shop for patients to go and actually find out more about what's happening in their disease area, and to look at co-creation, or to actually perhaps access something that's been created by patients or other partners?
Well, that's a very good question, and that's also a very good idea to have that in place. So I'm not aware of the one place where this may be driven by industry, but I may also not just be comprehensively informed. One piece, though, is for the patient innovation bootcamp that has also been mentioned. There is a website, it's patient-innovation.com, where the solutions from Europe, but also beyond that have been created, that patients have been working on, are actually all listed. Right. And they are also clustered. You can search them by condition or disease area. So that's possible. And in some cases, of course, industry is also involved. That's what I can contribute. Maybe other members of the panel have other more comprehensive insights.
Any thoughts perhaps from the patient perspective, Jaume or Esther?
I don't think that, I think that as Jan-Philipp said, that it would be great to have this kind of one single point where the patients can look for solutions. And for us, even for us, when we started with the project, would have been very good to try to find what we can find regarding or the disease, low vision or whatever. But I don't think that right now, I think that you have to research, but it's very difficult, actually. It's very difficult to get to know which projects are, let's say, open to the participation of patients or even driven by patients. So far, I must say that I don't know.
Okay.
Yeah.
Any comments from your side, Esther?
Yeah, I know that there's certainly from the academic research perspective a move towards PPI, public patient engagement. And now I think what's really important is that there's a recognition of the inclusion of that component within a proposal. And there are also kind of schemes emerging, maybe more so from the NGO sector or specific disease groups that make calls in connection with the funder to target particular areas. I know recently there was one from an epilepsy group in Ireland, and there's many others. But in terms, I think that's the encouragement. The encouragement is coming to include the person within the research proposal stage. And therefore they're coming, but as regard to repository as such, I'm not aware of one directly, just these efforts, grassroots type.
Yeah, I want to say that more than a single entry point, because this entry point, single entry point, maybe with the whole kind of diseases is very difficult to have. But I encourage all the patients to try to contact to patients associations, because, for example, in our case, we work with the most of patient associations in Spain related to the diseases that cause the low vision problem. So if they go to the patient associations, they will find for sure any initiatives that is driven by patients to innovate or whatever.
Great, thank you. That's a very concrete suggestion. Going back to Signe, I think there's been a question on the chat also that perhaps would be directed to you. There's a question at national level. You've talked about a lot of opportunities at European level to perhaps be recipient of funding or get involved in a consortia, etc. Are there sort of national contact points where interested patient representatives could go to find out a little bit more what's happening and to understand, let's say, the rules of the game, the deadlines, what the criteria are, etc.? I know those national contact points exist in certain areas, but what about the current suite of funding opportunities? What are the plans in that context? Signe, I think that one's yours.
Yeah, okay, very, very well. Now, certainly, as you mentioned, Nicola, there are national contact points for all areas, including related to health and health projects. Certainly, at the member state level, these can be contacted. Now, as regards the previous question, also, well, certainly all the results of projects funded by Horizon Europe, like it was in Horizon 2020, can be found on the results pages, which is also, they are accessible, available also to all member states, associated countries, and certainly then the patient organizations can also then via them have an access. All the results are now, all the data are basically, you have the open data principle. So certainly there will be a lot of opportunities to keep track. I can understand that for just for a patient is not possible to do that, but via the patient organizations, I think that would be also feasible. And when it comes to the business side, as I mentioned, now in these new partnerships, there's both the private and public partners, so the member states will be there, but also the business organizations, like on personalized medicine, on rare diseases, and certainly all of them also engage the patient organizations as well.
Great, thank you very much for that overview. That's very helpful, and obviously the patient organizations are important conveners, if you like, to help some of this information flow. And what's really helpful as well, for many of the existing projects, there are layperson summaries, so you can really understand and get to what the project has been about in a nutshell, but also its impact, which is also crucially important. We have a minute or so left to look a little bit deeper, and we've no more questions from the audience, but I'd like to take this opportunity to use the time wisely and just get a last statement from each of you, very, very short, less than a minute, just in terms of your impressions of the discussion today, the sessions, and what you will personally take home with you. And I'd like to perhaps kick off again with Jan-Philipp.
Thank you very much. Very insightful session. So two takeaways for me. I think we need to look into this this challenge that Jaume and others mentioned on how do we create settings that are possible when it comes to scaling and the business questions. So I think that's and managing of capacity. The other one on kind of trying to create more transparency, better inventory on what innovations we're working on, what patients can get engaged in. I think that's something, that's an ambition I would like to take with me as a challenge and see how we could maybe contribute. We're not going to solve it all by ourselves, but maybe we can contribute. So those are two things that I'm
terrific. Thank you very much, Jan-Philipp. To Esther, please, your thoughts from Ireland.
Thanks. Yeah, it's been a wonderful session, and to really learn more about what's happening from the European policy side as well, and connect that back to what we're aligning with. I think my takeaway really will be that piece for the patients. How do we make it accessible? How do we make that information about all these wonderful projects that are happening that we shared by others today? How do we make that accessible for patients to easily, connect with, understand, and that choice, the choice of how patients and citizens engage in research, which projects are meaningful for them, I think would be something I'd like to take away with me. Thank you so much.
Thank you. Thank you very much, Esther. And to Signe, from a Commission's perspective, what are your thoughts having participated actively in today's session?
Yes, it's been a very, very, very good session. So I'm glad that I was able to join it. Just one suggestion and one takeaway. The suggestion will be, in short, be engaged, continue to be engaged. And the takeaway is that we really need to see how we can better promote the ways how to be engaged and also the information which would be crucially important for all of you.
Thank you. And last but not least, Jaume.
Thank you, Nicola. Well, I'm very glad to participate in this meeting and to be able, let's say, to represent somehow the companies like us, the patients that try to innovate. And my takeaway, I have two takeaways. The first one is that I see that there is a clear intention. There is a wish of the EIT Health and EIC. So the institutions, the stakeholders, are really wanting to help and to promote the innovation by the patients. But my other takeaway is that I see that there is a lot of work to do. Yeah, like the idea that you have, there are many things to be done, which is something good, but it needs a lot of work. And well, I hope that this meeting is just a kind of kickoff. Indeed. Of more things that we can do in the future. And we are open, of course, to collaborate with EIT Health and of course, with the CC to start working on how to improve this.
Wonderful. Thank you. I think that's a really, really important message. A lot has been achieved, but there's still quite a distance from the patient to real co-creation, and patient organisations, representative patient organisations, can clearly play a very important facilitating role, but multi-stakeholder collaboration is really key. I'd like to close now with a really big thanks to all of you, to Signe, to Esther, to Mei-Lin, to Jan-Philipp and to Jaume, and to wish you all very well with your endeavours. It's been a terrific session. Thanks for the teams behind it as well. And please do enjoy the closing session that's starting pretty soon. Thank you very much once again.
Thank you all. Thank you. Thanks, Nicola.
Thank you. Bye.
Thank you. Thank you.